Louisiana's capital city, Baton Rouge, with a population of over 800,000 and growing, is a major medical research and industrial center of the American South. This is the home of Our Lady of the Lake Regional Medical Center, one of the largest hospitals in the state, with some of the top specialists in the country, 7,000 employees, innovative Heart and Vascular Institute, busy trauma center, dedicated children's hospital, a large physician group network. Our Lady of the Lake is widely known for its care of some of the most complex cases in the southern U.S. Now, a behind-the-scenes look into the operating room, and meet the men and women who are devoting their talents, passions, and time to saving and improving lives every day. This is Louisiana Med.
Hey buddy, how are you doing? Good. I'm Dr. Ness's partner. I'm going to be working with him today, okay? Do you remember meeting me? This case is a young man who was born with a congenital growth, essentially an overgrowth of his lymphatic vessels.
Jaquan is a 12-year-old who was born with a large deformity of the face and neck called a cervical facial lymphangioma. A lymphangioma is really a malformation of the lymph vessels. Most people know that we have arteries and veins. Those are blood vessels. Most people aren't aware that you have lymph vessels that transport fluid through the skin and other parts of the head and the neck. And when he was born and he was only this big, his face was this big because he had a big expanding mass attached to the side of his face and neck.
In the ultrasound, they never seen the cystic hygroma. He was like normal. They never seen any signs that he was gonna be born with a cystic hygroma until I had him at birth. He had surgery when he was 2. He stayed in the hospital for about a week, and then that turned out fine. And now he's having a second surgery because they want to wait till he get older to have another surgery.
When he was only 2, I operated on him and we removed the majority of that. But in babies, it's quite difficult to get it all out. So he did very well for a number of years, but at the age of about 11, he started to have a recurrence and his face started to swell again.
In particular with adolescents and children, it is the development of that social norm, and if they grow up looking different than other children, sometimes they're picked on, sometimes they feel different, sometimes it makes them shy, and it takes, oftentimes by the time they get to the college years where things sort of even out and people accept you for who you are, it's hard going through those years of adolescence and high school, having something that makes you different from somebody else.
I'm just hoping that his surgery is successful, and God gonna take care of him in his surgery, and he will be able to be a normal face, have a normal face.
Do you have any questions? You're a big boy now. You can ask all the questions you want. No? Okay. Okay, y'all. We will take great care of him. And y'all, I don't know if y'all remember how it works. We get back there, we get him positioned and asleep. When we start, we'll call you. And they'll call you every hour after that until we come out and talk to you. Okay. Okay? Don't be surprised if it takes a long time. Okay. Okay? We're just taking our time. It's around very precious nerves. Our goal is to make sure he can still smile and close his eye and everything just as he does now. Okay. Okay.
Thank you.
Take great care of him.
Okay.
Okay?
He's not nervous. I'm ready.
My turn. How are y'all?
I'm Mrs. Stanley Lee, and my son, Michael.
We're here today because my dad is having a left hip replacement surgery. He's really been in pain. He used to love to golf, and he just can't do it anymore. And we hunt, and Daddy can't really walk far enough to be comfortable hunting anymore.
Hey, how are y'all? How you?
I'm all right. How about you?
I'm pretty good.
You better be really good this morning.
Well, we're going to take good care of you, you know that. All right, one of the rules we have is you got to tell us what we're doing today.
Oh, we're going to fix that hip.
Which one?
Replace the left one.
There you go. I mean, what kind of pain do you have when you just try to do normal daily living things, like just getting up and walking?
Well, it depends on, some days it's pretty good and sometimes it's not.
Yeah.
It depends.
So it's starting to keep you from doing normal daily living activities.
It's starting to give way once in a while.
Yeah. You got a worn out hip, we know that. But when it starts interfering with your daily living, and when it starts, especially when a lot of people come, is when it starts keeping you from sleeping.
Orthopedic surgery in general has grown exponentially, and I think that it's much more sophisticated, it's much more technically demanding, but we also have a lot of toys and tools to help us that we didn't have 32 years ago. I mean, we can use computers to assess our alignment of total joints. You know, we didn't have CT scanners when I started my residency, and we didn't have MRIs when I started practice. So all of these technologies have made, I think, it interesting, especially over the last 32 years. It's really changed significantly.
At Our Lady of the Lake, we do approximately a little less than 20,000 procedures a year. We do a variety of procedures. In years past, we probably would have done a little bit more of the smaller cases, or those that you're now seeing done in the ambulatory surgery centers. But now what we're seeing is our more complex patients, more technology inquisitive type of patients, from a range of all services. We have orthopedics, general surgery, cardiovascular, pediatrics, open heart, dental, plastics, urology.
Each patient calls for different things, so one of the things that we always focus on is treating each patient as an individual.
You know, oftentimes we focus on the physical, but we want to take care of the whole patient. And so how do we spiritually connect with those patients? What our team does now is they offer to pray with the family and the patient prior to the procedure.
Anesthesia team that'll be taking care of you. Fill Mr. Stanley's heart with faith and help him to be calm and relaxed, and to remember that you are the source of my strength and courage. And I ask this in your name. Amen.
Amen.
All right, let's go.
Anybody who wants a kiss, now's the time.
Love you.
See you later.
See you later, Gator.
We're gonna treat him good for y'all.
Let's hope so.
Yes, ma'am.
All right, Daddy.
Coming up,
The patients, you know, call it a spacesuit.
learn more about the special precautions surgeons take to protect patients in the operating room, one man's journey to lose half his body weight, and an update on the progress of Jaquan's lengthy surgery.
His mom reminded me that his first surgery was 11 hours, and so I'm hoping it'll be somewhat less than that.
When you look ahead to the future, what do you hope for? Do you hope that things will stay exactly the same as they are today? Or do you wish for better? A better life for your children? A better world for your grandkids? It's just in our nature as humans to want something better. And it's no different for us. Because healthcare works best when it's constantly striving to be better. Our Lady of the Lake. The relentless pursuit of better.
What I enjoy most about my job is helping people. That's mainly why I became a nurse. I'm a people person. I love to help people. And here, each day, you encounter patients from all walks of life. And you meet so many different people, and that's what I enjoy about it.
We work with each other all the time, so I kind of know how she works or how he works. We work together, so I know like what she likes for her field and how she likes to set up, and so it helps. We have like specialty teams too, so those help a little bit because like I do vascular, so my vascular surgeons, I know their routine, I know what they like on the field, I know how my scrubs like to set up and everything, so it helps things run faster, smoother, and I think that in turn helps with patient care. Every patient is individualized and each case is individualized, so it's never boring. We're constantly changing. I mean, we have robotic teams now and they do amazing things too, and so we're constantly evolving, and I think that's really neat too.
I like waking up every day and going home every day knowing that I'm helping heal somebody and help them get over, you know, whatever they came into surgery for, whether it's, you know, a gallbladder or just a mass excision. Like, you know, some things really bother people, and I love being able to know I'm part of healing people.
Okay. Hey Marilyn, this is James. Can you tell the family of Stanley Lee his surgery just started? Everything's going fine at this point. Thank you, ma'am.
The patients, you know, call it a spacesuit or a hood, and we call it a hood, but it looks like a spacesuit. I mean, you're all enclosed. It has a battery that runs a fan, so you're breathing and recirculating your own air, so you're not, your breathing doesn't go out into the room. It stays in your suit, so it reduces the bacteria count in the room. And it's just one of the things that we use to reduce infection rate, and our infection rate here is below the national average. This anterior approach is, yeah, I've enjoyed it. It's been, you know, it's been challenging. It's been anxiety producing, but I tell you, the patients just have done so well so quickly. It's just a different approach, and you come in from the front and you go between the muscles. You don't cut any muscles in doing it. The dislocation rate for hips done posteriorly, which is the way most are done in the United States, is 4%. Dislocation rate done anteriorly is 0 or close to it.
All done. Yep, everything went nice. Yep, very straightforward. He'll be back in the recovery room for about 2 hours, hour to 2 hours.
Okay.
And then we'll get him up on the floor and we'll get him walking this afternoon if he feels up to it.
Yeah. Okay.
But it went very smoothly. If he looks great and shows off, he can get out of here tomorrow afternoon.
That'd be all. That's what he really wants.
All right.
Yeah.
Good.
That's what he really wants.
All right.
you.
Oh, you're welcome.
Thank you.
I'll check
so
back on him after my
Thank you,
next one,
Doc.
okay? You're welcome. All right, everything went great.
Yeah, everything went great. So
Can't ask for no more.
Most patients that have their hip or their knee replacement, or for that matter, have maybe both knees replaced, get up the next day from surgery. And even now, we're getting them up even the same day of surgery. If they've had an early morning surgery, they may be out of bed and walking a few steps the same day. The faster they move, they have less problems with developing problems like blood clots, pressure sores, and some of the comorbidities associated with surgery. And also, the faster they move, the quicker they get out of the hospital, and we see people advancing along that care plan, not needing as much therapy post-op if they're moving faster.
That's a lot.
All right, you ready?
Well, the further I went, the easier it got. It starts loosening up a little bit.
Our main things are hunting, and up to just a few years ago, at least one Sunday every other month or so, we get together as a whole family and play ball with kids from 5 years old to however old he is. But the last few years, he hadn't been able to play ball. And so those are things we look forward to because we're just an outside activity family.
Well, today we have our surgical chiefs meeting. We meet once a month. We start with a prayer, and then we have each discipline regarding surgery and some of the hospital administration to bring questions, concerns, problems, solutions, brainstorming about how we can improve the entire surgical process. Of all the subspecialties, you know, there's anesthesia, orthopedics, general surgery, thoracic surgery. Everybody brings their concerns into a confidential meeting that we can then unpack it and see what other perspective each other has to try to improve these things.
Robotics is a major advancement in the treatment of patients with minimally invasive surgery. There are 5 specialties using the robotics program: urology, general surgery, colorectal surgery, cardiothoracic surgery, and head and neck. Not all patients are candidates for robotic surgery, and not all types of surgery should be done robotically. There's certain cases that really should be done openly, and some that should be done with the robot. And it all depends on the patient's individual situation.
Robotics is a relatively new phenomenon as far as ENT is concerned. Robotics was essentially used for urologic surgery and GYN surgery, but there are certain applications for robotics in ENT which make sense. For example, it's currently used for the management of cancers of the tonsil and the back of the throat or the base tongue. And in these situations, traditional surgical options involved making large incisions in the neck, sometimes splitting the jaw to be able to just get access to the back of the throat. And what robotic surgery allows is for us to be able to do the same thing, but going through the mouth. So it's really a great surgical innovation in terms of us being able to do the same operation with less incisions, with less morbidity to the patient.
This robot we're in control of, and there's 2 little finger controls that you put in each of your hands that we actually control the movements of the robot. And the instruments that are used, like a laparoscopic instrument, are really run and managed by your fingers.
Very little that I do now is what I was actually trained to do initially. And when I was in a residency, all the surgeries were performed through big incisions. And the advancement of laparoscopic surgery and minimally invasive surgery, robotic surgery, has changed the way we technically do every case we perform. On the inside, anatomically, it's the same, but the approach and the patient recovery is much improved. I've really adapted the robotic technology into my practice a great deal because that's the next step, really. How are you?
I'm good.
Good to see you. All right, have a seat. Long time no see. We're over 2 years now?
It'll be 3 years, September 13th.
Wow, that's hard to believe. And how many pounds are we down?
You could say right at 200.
So you lost a big person.
I had the sleeve, the gastric sleeve. My pre-out weight was 444 pounds. And today I am 242 pounds. So I lost 202 pounds.
The surgery is one piece of the puzzle. How they modify their habits after surgery and commit to modifying their diet and an exercise program is important. So we actually also have them see a psychologist to make sure they're prepared for all these changes. And we have everybody go through a full medical evaluation to make sure they're in good enough shape to undergo the surgery. And then on the other end, it's not like after their incisions are healed, they're done. We follow them long term, basically every 3 months the first year, every 6 months the second year, and yearly after that to make sure they progress appropriately and maintain their weight loss.
I feel great. The excess weight is gone. I have the energy, I have the stamina, I have the endurance to do what I need to do. I didn't realize how big I was till I go back and look at pictures of me and see those pictures. I sometimes still can't believe that it's me.
Yeah, it's a partnership. Surgery's one part of it, but the fact is that you've committed yourself to behavior change, and you've made it successful. I've just helped you out, but you've really done the success. All right, sounds good.
Good to see you. All right.
All right, great seeing you. We'll see you in a couple of months.
All right.
All right, bye-bye. Patients with weight problems, it's been going on forever, and when they lose that weight, it's not just the weight loss, but it's how they enjoy life is incredible to see what happens over the course of a year and a half after they've had the surgery.
I think it's always gratifying and helps reaffirm why we went into this when someone has a good outcome and is just so happy and especially when they've come back with an improved quality of life, they feel like they can get out, get back to doing things. And sometimes it's benign diseases we're curing, and sometimes it can be fatal or life-threatening diseases such as cancer, and we can give them, a second chance at life with a surgical cure. It's always a real reward to me that I've helped someone get there and get back on track with their life, and it helped improve their quality of life.
That's the most rewarding thing, when you can just change their life. And most people don't think of that with a hernia, but with a hernia that's really bad, it's there every single day.
He fixed a hernia, he put in mesh of 2 different types. He completely rebuilt me and sewed everything together and told me, you'll be fine. And of course I have been doing good ever since.
There's just a lot better quality surgery done now in patients that have these hernias, and I'm really glad to be helping any way to do that. But to give them hope and to watch them progress through all that and then ultimately see how well they're doing it, that's really a lot of fun.
Coming up on Louisiana Med.
This
is the facial nerve monitor. So this is going to tell us if his lip or his eye is twitching. So as we dissect it off of the nerve, we'll know if we're close or if we're stretching the nerve.
Jaquan comes out of surgery. See the result next on Louisiana Med.
Better is performing major surgeries with only minor incisions. Our Lady of the Lake, the relentless pursuit of better.
If you think you're having a heart attack, your first decision can save your life. Call 911. Survive. Don't drive. As soon as paramedics arrive, treatment begins. They relay your condition to the hospital, where trained doctors and nurses prepare for your arrival. This saves critical time and can save your life. Survive. Don't drive. This message brought to you by Our Lady of the Lake Heart and Vascular Institute, proud sponsors of Better.
Better is performing beating heart bypass surgery in more than 90% of cases. Our Lady of the Lake, the relentless pursuit of better.
I am the program director for the Department of Otolaryngology and Head and Neck Surgery, so I am in charge of the residents and their training at all of our practice sites. Teaching has been something that I've really enjoyed, and if you enjoy your work and you watch somebody else enjoy their work and you have that in common, it's the best ever.
As a resident in the ear, nose, and throat surgery department, my role is to do everything that a regular ENT doctor would do. So we are involved in seeing patients in the emergency room, in clinic, in the operating room, in the intensive care unit. Really, we're all over the hospital. Our training in ear, nose, and throat surgery is, like many other surgical training programs, it's progressive. That is, as time goes on, you get more and more training and more responsibility. So in the first year or two, you may do more of a more routine surgery, such as a tonsillectomy or putting tubes in a child's eardrums. As time goes on, you may be involved in more advanced surgeries, such as a rhinoplasty, which is reshaping of the nose. You may be involved in fixing an eardrum that has a hole in it. You could be involved in taking out cancer from a patient's throat.
Being an academic physician is rewarding in many ways, but the teaching is a large part of it in terms of having the residents who are training in your field be interested in that and be eager to learn. Always with that inquisitiveness keeps you on your toes and keeps you moving forward, and it's our responsibility as physicians to train the next generation, and so it formalizes that process, and I think it provides better care for our patients. It makes us push forward and try and stay at the edge of what's happening with care and what's available by trying to make sure that we're keeping them up to date as well.
Our surgeons want to be the best surgeon that they are, and how do they do that is by having the best team with them. So we hear the comments, oh man, the team did an awesome job today, or we didn't expect this to occur during the case, but the scrub tech was right on it. The nurse had everything that we needed. She anticipated our needs beforehand. The most important thing about the surgical environment here at Our Lady of the Lake is the teamwork. And it's not, I'm the surgeon, I'm the anesthesiologist, I'm the nurse, I'm the surgical tech, but it's everybody working collaboratively to make sure that the most thing that we focus on every day, every hour, for every procedure is the patient.
So Jaquan was born with several congenital anomalies. The biggest one is this lymphangioma that was really quite gigantic when he was a baby. So we took the majority of that out, but he was only about this big, so you're limited in how well you can do it. So our usual approach to that is do a big surgery when they're an infant and then let them grow. And as the body gets bigger, the subsequent surgeries become a little bit less dangerous and more achievable. So he's back now as a teenager for us to do a more of a contoured removal of that.
So we'll just wait to get dry. So this is the facial nerve monitor. So this is going to tell us if his lip or his eye is twitching. So as we dissect it off of the nerve, we'll know if we're close or if we're stretching the nerve.
Yeah, not a whole lot. Anyone? Got it. It's right under his head. The Jaquan's operation took us almost 18 hours. We got started a little bit late in the day, so it was right around noon, and I think we finished up just before dawn the next day. The recovery from that, as you might imagine, is going to be not an overnight recovery. Right now, he's doing fine. We expect that he has what he has now, which is a little bit of a facial paralysis and some temporary swelling, which will go away. But Jaquan is unsinkable. He's really a neat young fellow, and he's always energetic, and he's always smiling, and he's going to do fine.
The facial expression is something that people really hold dear, and it's sort of their outward appearance to the world and how they express themselves. And when it's lost, it's sorely missed. And being able to give patients back something that helps them function normally when they didn't know how they were going to function with where they were at some point, and then you can put them back into a world where they feel like they were before, and that's truly rewarding.
You know, we were talking about music in the OR, and I think it's an interesting subject because I was in an operating room yesterday where the surgeon I was working with permits no music at all. And there are others who you feel like you're in a rock music concert. The philosophy is not too mild and not too wild.
By default, my wife makes me do that. I don't think it's quite the same at all, but I actually do sew up all our clothes at home. When something needs to be sewn, she's assigned me to it. So yeah, I do. I can sew here and there. It's not really what I choose to do, but by default, I do.
Well, you know, my wife has accused me for a long time of trying to worry people well. I still, after 32 years, if somebody's having a complication or a problem, still don't sleep very well.
I lose sleep at night over patients. Sometimes you become very close with families. I mean, I've cried with families, I've laughed with families.
It's a fun job, and it continues to be fun.